Hi everyone, I want to talk about hyperbaric oxygen today. Without wasting your time, let's go. By definition, hyperbaric oxygen involves a gas at a pressure greater than normal. It's also an increased concentration of oxygen in tissues from compression chamber administered oxygen at an ambient pressure greater than 1 atmosphere of pressure. Hyperbaric oxygen therapy involves breathing oxygen in a special pressurized room or a special pressurized small chamber. It is also a component of diving, undersea, or hyperbaric medicine. Recompression in a hyperbaric chamber is used as a treatment for decompression sickness and arterial gas embolism. The naval officers, the divers, they are all used to this. The technique: a single chamber is available for only one person. If you are dealing with a chronic medical condition, you can use a single chamber. There's what is called multiplex chambers, and that is very easy to monitor loss of critically ill patients. The pressure is set between 2.5 and 3.0 atmosphere, and treatment is lasting between 45 minutes to 300 minutes. Still on technique, one or two treatment is okay for acute therapy, while a chronic medical condition may warrant up to 30 sessions. Hyperbaric oxygen is administered with pressurized oxygen or air. The pressure in the chambers is increased to 3 times the normal air pressure. Oxygen is carried around the body under a very high pressure. With that, it helps in fighting bacteria, to stimulate the release of growth factors, and of course, of the stem cells, thereby helping in healing process. When do we need this? It is used when we are dealing with air embolism, gas embolism, carbon monoxide poisoning, decompression sickness. In fact, that is the main reason for developing the system in the first place. Traumatic ischemia, crush injury, clostridial myonecrosis, problematic wounds, diabetic wounds, severe anemia. Three parts of the uses will be in refractory osteomyelitis, radiation necrosis of bone and soft tissue. We also use this in necrotizing soft tissue infection. In gangrene, we use hyperbaric oxygen, and when we're dealing with sudden deafness, we can use hyperbaric oxygen. And the last but not the end of the story will be its use in actinomycotic brain abscess. What are the possible complications? It's generally safe, but we could be dealing with fire. So you get a fire extinguisher around, or you have the phone number of firefighters ready. It is well tolerated by a lot of people a lot of times. Could be dealing with myopia, and particularly those who have been diagnosed with refractive error, with short-sightedness, then it's going to get worse. We might be having middle ear barotrauma in about 2% of people who will use it. And with that, we might be dealing with middle ear effusion, hemorrhagic or not. The tympanic membrane could be ruptured, and that will prevent its use on frequent basis. It is relieved by autoinflation techniques or by tympanostomy tube insertion. Still on complications, might be dealing with sinus barotrauma, evidence with upper respiratory tract infection, nasal decongestants before and during the therapy will be helpful. And that is why steroids and antihistamines are very useful here. Might also be faced with pulmonary barotrauma. Though this is very uncommon, but it can present with atelectasis and pulmonary edema. Still, on pulmonary system, the oxygen toxicity could give us chest tightening, give us cough, in my guide to the brain, giving us seizures, and of course, decompression sickness if nitrogen is involved. What are the possible contraindications? Untreated pneumothorax is an absolute contraindication. Let me repeat. If the chest X-ray is revealing pneumothorax, no matter how small it is, but not treated, that is an absolute contraindication. So we have to take chest X-ray or CT before putting the individual in that chamber. Still on contraindications, but this time relative contraindications, meaning not absolute, so you can weigh the advantages and disadvantages, then go ahead based on your judgment. And that will include upper respiratory tract infection, pulmonary blephs, sinusitis, recent cardiothoracic surgery, any recent fever, history of seizures, and claustrophobia. Here, that is extreme or irrational fear of what? Of a confined place. But what do you think about that? Should that even be part of the considerations, for not having hyperbaric oxygen? I don't blame anyone who will be confined into a chamber for 45 minutes up to 300 minutes to have a kind of fear, right? I don't blame them. Well, maybe psychotherapy will come in then when the individual is comfortable with you, or you allow the person to watch an episode, seeing somebody going in and coming out later on being treated might encourage the individual. So I don't blame them. So that's why I put dash there. You fill in the gap. I don't want anyone being blamed for that. Anybody could have that fear. With that, I've come to the end of this short presentation. Hyperbaric oxygen is very useful. Thanks for listening. Remember to share and subscribe. I appreciate it.